Good afternoon. Glad you're all back. I hope you took some time to do that thing that we've been talking about all morning to take care of the caregivers. You are first responders and you mean a great deal to us. I'm here to welcome you to our afternoon proceedings, starting with Ms. Kelly Cox, who is the Senior Director of Global Alliance Development for Johnson & Johnson. Kelly is the Senior Director for Global Alliance Development at Johnson & Johnson. In this government affairs and policy-based position, Ms. Cox is responsible for developing and overseeing implementation of public policy advocacy strategies in the United States and at the global level, working in partnership with advocacy organizations to strengthen health systems and improve access to high-quality healthcare. Ms. Cox works across all of Johnson & Johnson's subsidiaries, supporting key policy issues, enterprise initiatives, social causes, including advocacy, partnerships to support frontline healthcare workers, improve maternal health, and address health disparities. Prior to joining Johnson & Johnson, Ms. Cox most recently served as Senior Vice President at Edelman, leading the agency's national health alliances groups. Prior to that, she was Vice President at the Public Affairs Consultancy, APCO Worldwide. Her work for clients spans across several disciplines, including public affairs, corporate social responsibility issues, management, and public policy. At the outset of her career, Kelly also served on advance teams for the Clinton White House and for presidential campaigns of Vice President Al Gore, Secretary John Kerry, and General Wesley Clark. Kelly, welcome.
Thank you. Thank you. Thank you for having me today. It's a real honor to be with you at this pivotal time. So as mentioned, I'm the Senior Director of Global Alliance Development for J&J. So focused on policy advocacy, really thrilled to be here with you on your Hill Day. And I'm here to provide an update on the work that we're doing on the coronavirus pandemic, as well as our mutual efforts to support health equity and particularly addressing maternal mortality. So I was honored to speak with you last year at Hill Day about Black maternal health, and given that it's still on your priority list, wanted to touch on some of the policies that we'll be both fighting for in 2021. So with that, I will pull up some slides. Okie dokie. So I'll just dive right in the interest of time. While I'll be going through a lot of information, I promise just to touch on 1 or 2 points per slide, and for the sake of time, I won't repeat some of the really eloquent points that Dr. Richardson Heron from Pfizer made about the disproportionate impact of COVID on communities of color and the systemic racism that we all have to work hard on to change for the better. But I do want to emphasize that our J&J team has an open door for further discussion and information sharing with the NBNA and its membership on these critical topics. So here's how we're mobilizing at J&J to address the pandemic. We've been actively engaged in fighting pandemics for over a century. We've done it before, we'll do it again. But with our global reach, we know that comes with the responsibility and unique ability to leverage our scientific expertise and partnerships to take on the challenge. So we have more than 130,000 employees around the world who are working day and night to address the needs of families and communities and healthcare providers around the world. So our first contribution that our teams have been working on since January of last year is our COVID vaccine in development. And our aspiration from the beginning has been to create and deliver a simple, safe, and effective solution for the largest number of people possible, maximizing our impact and bringing as swift as an end to the pandemic as possible. So as you know, we've been studying a single dose vaccine. So we recently announced top-line efficacy and safety data, demonstrating that our investigational single-dose vaccine met all of our primary and secondary endpoints, which I'll get into in more detail momentarily. And we're supporting frontline health workers, as we've always been, committed to supporting nurses. So this last year, we committed a total of $300 million to support frontline health workers. First, through our new Center for Health Worker Innovation, which we launched just before the pandemic, and then another $50 million specific to pandemic response support for nurses and community health workers. And we're taking action to support health equity in communities of color and working with partners to educate the most at risk about vaccines, most importantly with NBNA, who has been leading on that from the beginning. So very quickly, just want to reinforce that, we take a science-based, ethics and value-driven approach to medical safety. So we do put patient safety and consumer well-being first and foremost in all of our decision-making and actions. So, and we know that transparency of the data advances science and medicine and is in the best interest of all to do so. So we have been developing our vaccine in accordance with the highest ethical standards and sound scientific principles, and are committed to transparency. So we are expeditiously seeking publication of results from clinical trials of all of them in peer-reviewed medical journals, and are working together to share all of our data through a Yale University Open Data Access project, the YODA project. So I'll talk more about diversity in clinical trials in a moment. So about the vaccine that we're testing right now, the technology that we're actually using, so what we call our Ad26 vector, which is focused on, or it uses the adenovirus, we've been using in multiple vaccines we've been studying, from Ebola to HIV to Zika. And so we have studied this technology in over 200,000 subjects, and that, that includes infants, HIV, adults, pregnant women, et cetera. So just wanted to touch on that briefly. And then this is what we've been doing. So the press release that came out on Friday was about the very top line results from Ensemble 1, which you can see we have. I'll share the data in just a moment, but we initiated this in collaboration with the Biomedical Advanced Research and Development Authority, so BARDA, which is part of HHS, and then also working with the NIH as well. And now we're currently enrolling a second study to test safety and efficacy in a 2-dose regimen in up to 30,000 adults to see what that does to efficacy as well, so we have as much data as possible. And so those trial sites are also in South Africa and also UK, where the virus variants are spreading. So this is a really important set of data, so really wanted to share this. I mean, we know that diversity is an essential in all research, and especially important for this vaccine. So I'll just point out a couple of numbers here. For the US participants, Black, African American participation was at 13%. The 2010 census had the percentage overall average at 12.6%. And certainly higher at the global level, as one of the sites that we were focused on was South Africa. So we were testing amid the raging of the pandemic and when these new variants started coming out. And then we really did ensure that we also had diversity in terms of, participants with comorbidities. So having as much, real life data as possible. Okay, so the top line results. So we met our primary endpoints. You've probably seen multiple numbers here and in the news, a little bit confusing, but a couple of things that I want to point out. So when it comes to severe disease, the vaccine candidate was 85% effective overall in all regions studied, 28 days after vaccination in all adults, and we were testing in adults aged 18 and older in this trial. So protection was consistent across race, age groups, including adults over 60, and across all virus variants and regions studied. And then The study results include, efficacy against the newly emerging strains, including some highly infectious variants present in the US, Latin America, and South America. So finally, a main point here is the candidate demonstrated complete protection against COVID-related hospitalization and death. So there was a clear effect of the vaccine on COVID-19 cases requiring medical intervention, which included hospitalization, ICU admission, mechanical ventilation, etc. And there were no reported cases among participants who had received the vaccine. So complete protection there. And then in terms of adverse events with this single dose, the candidate was generally well tolerated. So overall fever rates were 9%. Grade 3 fever was 0.2%. Overall serious adverse events reported were higher in the participants who received placebo as compared to the active vaccine candidate, and no anaphylaxis was observed. Okay. So that was a lot, but really wanted to make sure that we shared this data up front. There's a lot of information flying around, and wanted you to hear some of that top line from us as we submit to the FDA for emergency use authorization in the coming days. So to pivot here more into the policy realm, one of the things obviously that we touched on in terms of our commitment and what we've done specifically around our vaccine enrollment and recruitment was really to ensure and address historical underrepresentation of racial and ethnic minorities in trials. And so of all the activities that we've been doing, we also launched something called researchincludesme.com, which is a resource for communities to gain a better understanding of clinical research and the importance of diverse participation. So in this case, we are working on a legislative proposal and socializing some of those ideas with our partners and stakeholders. But the very top line is seeking additional FDA guidance on how we can decentralize some of these clinical trial designs, making it easier for participation that is not so completely focused on academic medical centers that can be hard to get to, and more guidance on new and novel protocols. We're also asking if there are policy solutions to allow us to provide for free various digital technologies to participants so that we can do some of the monitoring remotely and make it, again, easier for participation. And then another key element here in the proposal would be grants to community organizations from the government to assist with community education, outreach, and recruitment. So pivoting just a little bit here, one of the things that we really know is how important it is to be conducting vaccine education at this point in time, when the most vulnerable are also the most hesitant for so many legitimate current and historical reasons. So that's one of the reasons why we're here today, and know how important that messenger is. So we're here to elevate the trusted voices and sources of information. So working in partnership with NBNA and other trusted community leaders who are really best positioned to communicate accurate information about vaccines in the current context. So in terms of healthcare provider associations that we're partnering with, most importantly the NBNA and the Black Coalition Against COVID that the NBNA co-founded, but also the American Nursing Association, the Association of Immunization Managers, the National Hispanic Medical Association, and others. And then groups with a civil rights heritage and trusted leaders and advocates. So the National Minority Quality Forum, the CBC Foundation, the Urban League, and community health organizations from the National Black Church Initiative to text message, health message service, care message. So I'll leave that there and pivot to maternal health. So I will not belabor these points that you already know, but to say here, at Johnson & Johnson, we believe Black Lives Matter, and it shouldn't have to be said that Black women deserve to have safe and healthy pregnancies and childbirth and postpartum care. But given our longstanding support of mothers and babies, we've continued to carry this torch in recent years by driving our support of policies and critical solutions to address the U.S. maternal mortality crisis. And as Dr. Dawson so eloquently said, this is also a case in point about how we must be addressing political determinants of health. So just to touch a bit on this, in 2018, along with many nursing and medical specialty societies and grassroots groups, J&J co-founded the Equitable Maternal Health Coalition, which you can find at equitablemhc.org. And also on that website, in 2019, we worked with the coalition to develop resources to make the case that Medicaid postpartum care and coverage should be extended from the current 60 days to 1 year, which is certainly a policy that has grown in momentum. And then particularly as Congresswoman Underwood mentioned earlier in the day, the Omnibus bill will be reintroduced and includes a number of important policies under that banner. And then J&J was the only corporation to endorse that legislation last time around, and we will do so this time around as well as supporting the Pregnant Workers Fairness Act, which recently passed the House. So last slide, I promise, but these are some of the high-level policy recommendations that we've been making in capitals around the country and in DC, knowing that federal and state action is a crucial part of the solution. Increasing access to care, as I mentioned, some of these Medicaid coverage, but also more innovative care models that address real social determinants of health. Fully funding maternal mortality review committees, the 2018 bill that was passed into law, the Preventing Maternal Health Deaths Act, did some of the funding there, but certainly not enough for states to be able to rely on that funding across the board. And it's really important to capture that data to understand the problem. So with upcoming state budgets getting crunched, this will be another important area to make sure that the review committees continue to be funded in all the states. And then empowering the payers and providers. More value-based maternity care programs that really measure outcomes and have the right incentives in terms of payment models to improve care. And finally, acting workforce policy, so including paid family leave is really, really important. So with that, I want to once again thank you for the invitation to speak with you today. It's an honor to be partnering with NBNA on these critical issues, and we thank all of you for everything you do every day throughout the worst public health crisis of a generation. Your compassion and your dedication inspire all of us at J&J, and we're here to support you. And so with that, Dr. Byers, I believe you might have a question or two if there is time remaining.
We reflect the people we take care of. And sometimes they have some concerns. And one of the concerns is, can you briefly describe or explain the vaccine distribution process? When we hear all this stuff in the news and on TV, we're kind of asking, where is it coming from, where's it going, and who makes that decision?
Yes. So as I mentioned, we partnered with the federal government in the development of our vaccine with BARDA specifically. So they invested about $500 million. We invested about $500 million. And that, was for the actual development. The way that vaccine distribution, works is essentially through government decision making. So when it leaves, our facilities, it is out of our hands. That being said, we really do welcome, partnering with organizations like yours to identify, some policy solutions to some of these inequitable allocation issues that we're seeing happening right now. And sincerely hope that as the Biden administration is really taking over, that some of those can get ironed out on the government side. But that is definitely a challenge, and the manufacturer's role is fairly limited. But we're here to help try to figure out if there are advocacy solutions.
And then one quick question, and I'll end our session, this part of it. You mentioned that Johnson & Johnson has some kind of techniques to get this information to the man on the street, the Black man on the street. Let's be exact. Does Johnson & Johnson have any ways of bringing the language? So you're talking to us as a bunch of professionals, bringing the language in your explaining to the public down to the, not down to, but to the level of the man on the street, who could then understand what this thing is all about. I think that's part of the fear about taking a vaccine. What's it all about that they should, a few words, just what should be their takeaway?
Yeah, no, absolutely. And it is a challenge for a bunch of scientists to kind of boil some of this language down. And we've been learning. I mean, we're really fortunate to be able to present to the Greater New York City chapter with our expert, Dr. Chime Nadi, and even learn from that in terms of some of the language that we use that is not very layperson friendly. So some of the things that we're doing to try to demystify include, supporting a number of different campaigns from BIO, which is our trade group, the COVIDvaccinefacts.org, which breaks some of this down in much more friendly language. So that would be one. And we also really know how important the messenger is. So supporting the Black Coalition Against COVID-19, where it really is Black doctors and nurses who are trusted by the community, being those messengers and breaking that down. And so we know we need to continue to do a better job there. And in some ways, before we have approval, what we can explain is fairly limited. But working with you all and getting that intelligence from you is also really, really helpful to us. And one of the things that through these partnerships around vaccine education, we're hoping to learn and improve.
So if there are any more questions, is there a way we can get in touch with you or with Johnson
Absolutely.
Johnson?
Yes. So I'm the member of your corporate roundtable, and the door is open.
Okay. Thank you so much, Kelly. Your presentation was very informative. We appreciate it.
All right. Thank you.